Hi, I'm Jeff Johnston, host of the Living Undeterred podcast, and I'm really excited about this special guest today. A good friend of mine, a dear friend of mine, for many reasons, and we can talk about a lot of stuff today. I didn't even know where to start with you, Ryan, because there's so many different areas of interest I'd like to talk to you about. Before we dive into all this, for the people that don't know you, which they must be living in a cave if they don't, maybe a little bit about you, where you are, where you live, kind of what you're currently doing, and then we can kind of segue into some of the important areas I think our listeners and followers would love to learn more about your work and so forth.
Sure. Well, it's always good to be able to spend some time with my friend Jeff Johnston, and great to be on your podcast. I'm Ryan Hampton. First and foremost, I'm a person in long-term recovery from addiction and mental health challenges. I just celebrated 11 years sober last week. I'm an advocate. I'm an author. I've written 3 books: American Fix, Unsettled, and Fentanyl Nation. My most recent one came out September of 2024. And I'm also the founder of a nonprofit organization called Mobilize Recovery. We're a national not-for-profit organization dedicated to lifting up the voices, experiences of people who are impacted by addiction and mental health in policy conversations and through advocacy. We also have some direct service programs. We've distributed 1 million doses of naloxone in 24 states since 2019. We're piloting a peer support program of embedding certified recovery peers in emergency rooms to help folks when they come in for an overdose or addiction issues. We firmly believe that the voices of folks with lived experience should be front and center when it comes to driving policy around substance use disorder and mental health in the United States. Sadly, we've seen, I think, a lack of policy action, not just on the federal level, but also state by state on this issue. And we're working to close that gap. And I have some exciting news, since I assume this cannot post today because it doesn't come out till tomorrow.
This is not live, so far away.
It's not live, and it will post after tomorrow, I'm hoping.
Okay.
It has to post after tomorrow. But the exciting news I just found out, and I'll be able to add to kind of that laundry list of stuff, and excited and grateful. And by no means is it a me thing, but my mouth dropped to the floor when I found out last week. But I was named to the Time 100 list that publishes tomorrow for health, as one of the 100 most influential voices shaping global health in 2026, which is just insane to me. But very exciting. So that comes out tomorrow. So
congratulations in advance. Not shocking.
It was shocking to me, and it was shocking to my mother too.
Because you're so humble. I've known you for quite a while, and I will say that you're authentic and very humble. So I know that you're gracious in accepting these things, but I know you'd like to deflect the attention to other things. But I first met you when I was looking at doing my tour back in 2021 or so. I remember jumping online and just kind of searching around, and had anyone ever bought an RV and drove around the country, with on fumes, borrowing money from everybody, and
the crazy people, right?
Yeah. And there were you and Garrett right there, in a Winnebago, I think. And I'm like, okay, I'm not the only crazy person doing this. And I watched your documentary and just got pulled into your advocacy, and then, found out about your story and your willingness to share. It's almost like you're not building in public, but you're growing in public, and you're very vulnerable. And I think on one hand, that's great when you're on this side of the fence like we are, but then it opens up the ability for people to take pot shots as well. And now that you're in the political sphere, that can come full front and center. And it can go back to any interview you had any time and pull a clip and then throw that against you. But Do you see now, maybe first just explain what you are currently running for? And again, I'm excited to come out and knock on doors for you and help you, even though I'm in Iowa. It doesn't stop me from hopping on a plane and supporting you. Tell my listeners what you are running for and kind of where you're at, and then maybe your experience with the last time you ran and what you learned from that.
Oh yeah. So I am running for the state legislature in Nevada for the Nevada State Assembly District 9. One of my organizing principles and the organizing principles of Mobilize Recovery has always been, we got to get in the middle of this thing, in every which way that we can. And, running for office is an extension of that for me. Nevada ranks 51 out of 51 in terms of mental health care access. We are the first state in the nation. We have a lack of providers. We have a lack of clinicians. We have a lack of centers. We have terrible insurance reimbursement rates. We have mental health parity being violated every single day with lax enforcement. We have a very wide-ranging youth mental health crisis in the state. And I hope to be able to turn that around and go from being last to start leading. I'm a big believer in what's called a care economy. The vast majority of Nevada's economy is built on tourism and mining, and it has been for some time. And I believe we need to diversify our economy, not just to protect our workers and our businesses from catastrophic things happening like COVID and tourism shuts down, right? And then the whole state goes upside down. But really, we can kill two birds with one stone, for lack of a better term. We can help solve this mental health crisis we've got in this state, and also provide high-paying jobs and provide for the opportunity for more construction and building for our unions. By incentivizing a care economy and putting in staff to patient ratios so that nurses and healthcare workers aren't so burnt out, right? And making sure home healthcare is a huge issue here in the state, making sure our home healthcare workers, are paid a decent, livable wage, and one job is enough for them. So, I think there's a lot we can do, and it's, these are the reasons that propelled me to get more involved politically. Now, running for office is not easy. It takes a lot out of you. It takes time. It takes energy. It takes calling people up and begging them for money, which I got to do constantly. It takes, like you said, the personal side of it. People take, cheap shots at you all the time. I get that constantly, since entering the political sphere, and that's fine. Somebody put it to me. Last election, I ran in 2024 and I lost. But I'm also a big believer. You come back and you pick back up where you left off and let the chips fall where they may. And a lot of folks said some really nasty stuff about me, and there was crazy television ads and social media, and I
saw them.
Talking about my history when I had chaotic drug use and my positions and whatnot, and you get these. I won't repeat it because it's not suitable for a podcast, but I had a person, just the other day, their Twitter handle was like insane what the name of it was. And they were going tweeting right about Ryan Hampton this, Ryan Hampton that. And I had a person I work with, a colleague, who was like, look, just put it down. Like, just think of it this way. If you were walking on the street corner and there was like somebody there screaming obscenities at you and saying, would you pay attention to that?
Right.
And the answer is no.
Just keep on walking.
Like, the same thing exists in the online world. Like, why am I going to pay attention to it there? Right. So it's, there's a lot of mental health practices that come into play, a lot of living in the moment, and a lot of deep breaths, but I think I'm faring so well, faring decent so far.
Yeah. Well, I can respect a lot of what you said, especially on the financial front, because, as a CEO and founder of Brighton, we're constantly out trying to fundraise as well. And then, obviously the goal is to make this a sustainable business with, revenue coming in. But in the meantime, as you build, you need people to believe in you. But I want to go back to your most recent book, which I have a copy here, by the way, just to show everybody. Fentanyl Nation. And, you had a very important role in the whole Purdue pharmaceutical, shutdown, lockdown, all that, however you want to phrase it. Yeah. Basically had a lot to do with that. Do you mind going back and talk a little bit about, because that seems to me was where the first like real domino fell in this space, where we actually won. But then there's also a lot of mixed blessings in how the proceeds, the settlement money's been distributed, the timeliness of it. Where is it really going to the people that are in need, or is it being spent on other things? Maybe just a few minutes talk about how you got involved into that, because I think that's a foundation that you can build on. That's one of the reasons why you are in the top 100 of times, people there recently. You're not afraid to go to bat and sit across the table from Big Pharma, and power to you. But I think I'd love to have you share a little bit about what you learned from that and kind of where the settlement money currently stands and what are some of the challenges you see with what happened there.
How deep do you want to go, Jeff? Because we can go pretty deep on this one.
Let's just pretend you're maybe just a high level, because a lot of people aren't as in tune with all this as you and I are. Obviously, with Seth dying from fentanyl, and you're, you've shared a lot of your experiences with your struggles and friends that you've had to save with Narcan and all that had overdosed but lived. Maybe a little bit about just high level, for some people that aren't familiar with who Purdue is, what the settlement was, and where's the money actually going and when.
Yeah. Well, let me back up a little bit and give a little bit of the history on how I ended up there.
That'd be great.
You bring up taking on pharmaceutical companies and I've also taken on politicians and whatnot. But like with the Sackler family, like they're true bullies, and I can kind of spot a bully a million miles away. I dealt with it a lot growing up, a lot of trauma there. I'm a survivor of adverse childhood trauma and sexual abuse and a lot of things that I had to deal with, in recovery and continue to deal with today, through therapy. Taking on bullies has kind of become like a thing of mine, right? And the Sacklers and a lot of pharmaceutical companies are right up there with the biggest and the best of them. I early on in my advocacy, right around the same time as the Facing Addiction Across America YouTube that you found me on, right? Went online. I had taken a target on the Sackler family in Purdue. I had known about OxyContin, obviously, because I had used it. I knew about Purdue because it was the label on the bottle that I used to take. And what I did not know about was the story behind the company and the family and the marketing history and the involvement of federal investigators and the settlement, master settlement agreements that had happened in the early 2000s. Like I knew nothing about that. And the more and more I did my own research and due diligence, the madder I got, right? That here was this company that was knowingly marketing this drug in a way to get people like me hooked. And then federal government regulators were basically being paid off in a way, to ignore what was going on. So I put a target on them and, wrote about them a lot in different publications and op-eds. And in August of 2018, had the first really big direct action in front of Purdue Pharma that I co-organized with a woman named Cheryl Jouer. In front of their headquarters on Tressler Boulevard in Stamford, Connecticut. And we had 500 family members. Wow. August of 2018, and led this huge protest to demand that Purdue divest their profits into community-based resources and actually, help solve the issue. And that got me some, I guess you could say, like notability on like the
some
issue.
So it got you some street cred. Yeah.
Yeah. It gave me some street cred, and people started to pay attention a little bit more. And attorneys general were looking at lawsuits at that time. Right. And what they could do through the legal system. And I was talking to multiple attorneys general from around the country. And then lo and behold, in the fall September of 2019 or August of 2019, Purdue Pharma decided that their liability, financial liability was way more than what they could afford that states were suing them for. So they decided to file for bankruptcy in White Plains, New York. And that set off a whole domino effect of a chain reaction of events, that pretty much changed the trajectory of my life for years to go. There was a committee, a little known committee called the Unsecured Creditors Committee, which would be appointed by the Department of Justice after Purdue filed bankruptcy, which basically would serve as like a mega plaintiff for all the different groups that were harmed by Purdue. And you had to apply to be on this committee. And I had learned about it by doing my due diligence one night, sitting just being like, how can I have voice in this? And applied for the committee. And the DOJ reached out to me and had me come in and interview me. And they appointed me to this committee. And I was subsequently elected the co-chair of it. And, I was put under NDAs and, these very long non-disclosure agreements and, court orders that I couldn't talk about the process or the settlements or the negotiations. And, for 2.5 years was involved in ultimately, negotiating a settlement that would be for victims, a deal for all creditors, participated in, thousands of hours of, phone calls and hundreds of hours of depositions, with the Sacklers. And this was during COVID, right? And I write about it at length in both Unsettled and in Fentanyl Nation that it, my view from the inside was very different from what my view was from the outside. And I had gone into it thinking, hey, this is about justice. This is about, fighting to make sure that victims, are receive some sort of justice in terms of payments. And, we're going to hold the Sacklers accountable. And it wasn't really about any of that. It wasn't about justice. It was about money. Bankruptcy is about money. And it was a very complicated and contentious battle for 2.5 years, fighting against what you would think were allies, state attorneys general, right? Who wanted the money for their states, and hospitals that wanted the money for their hospitals, and insurance companies that thought they were owed the most money. And here we were, 130,000 something victims, and we got the smallest piece of the pie at the end of the day. So I think
what was the total settlement amount, Ryan?
Well, it's about $800 million right now, still, which has not been paid out yet. There was a lot of, I resigned in protest from that committee in September of 2021 and got very vocal about the process because I felt the process was very skewed and unfair and corrupt in a way. And being driven, primarily by Purdue and the Sacklers and the states, and that victims were really sidelined the whole way. And wrote Unsettled as a result of it because I felt, I felt if the process wasn't really exposed, it would repeat itself again. There's a lot of talk in Congress about revising the bankruptcy process as a result of what happened in Purdue. I've testified in front of Congress. I've testified in front of Senate Judiciary Committee calling for these changes. Kind of blew the whistle last year on 60 Minutes about the process because I really feel that, if we don't fix it, it was Purdue today, it's going to be something else tomorrow, but
correct.
It was maddening, right? And I think that one of the misconceptions that people have is that there's all this money there that could fix the overdose crisis. And that's just, not true.
It doesn't work that way. I wish you could write a check and get rid of addiction and stuff, but it doesn't work that way.
No. And all the money from these settlements, was supposed to, be, close to $1 trillion when we got into it. And, that just hasn't panned out. It's a couple $1 billion, it's, $50-60 billion, spread out over multiple years. All the settlements, together in aggregate. we need to look at other revenue streams and other creative ways, to pioneer, new thinking around, how do we, build community? How do we provide the resources people need, on demand? How do we, integrate substance use and more mental health support into the primary care system? How do we build a care economy, right? And how do we how do we create more, new and different revenue streams that are going to pay for these things? And I'm a big believer that yes, there's a big part in government, but I think it needs to be, philanthropy. I believe it needs to be government. I believe it needs to be businesses and enterprises that step up and do this, almost through a public-private partnership model. Like, I think there's a role for everybody to play, because everybody, whether or not you believe you're impacted, everybody's impacted, and it may not be physically through health and healthcare or a loved one, but it's through the economy, right? Like, when we do better on this issue, the economy does better, and it saves money in the long run.
Yeah, everybody's impacted, and I speak a lot about collateral damage and the impact on a family. And you don't have to have death to occur like it had in mine twice to have devastation and destruction. I mean, matter of fact, more times than not, death doesn't occur. Right. That's more of an edge case. So I want to talk about the deaths as well when it comes to opioids, because when Seth passed away in 2016, Ryan, I think it was 42,000 Americans had passed away from overdose deaths. And then it spiked, I think 112 may have been the spike. What's the current number last year? And I know there has been a lot of talk about that number has decreased. I mean, what are your thoughts on that? Is there more in these numbers that's not being told, or are we making progress when it comes to overdose deaths?
I'm in like a wait and see moment. Look, that the numbers have been rapidly going down.
Right.
As a result of.
And why do you think so?
Well, I mean, we had a large saturation of naloxone on the ground. There were huge investments into recovery supports and peers. We got rid of the X waiver, so it's easier to prescribe buprenorphine in primary care settings. Like, there were a lot of work done to get people help and be able to pay for help. But the numbers, also the national trend's going down, but I mean, I'm, my feet are where I'm at right now, which is in my hometown of Las Vegas, Nevada. In Nevada, we're seeing an increase, we're one of the few states that's seeing an increase in overdose deaths. So I think we can be cautiously optimistic that we may be headed in the right direction, but I believe we have to be very careful, because that can be reversed just as quickly as we started,
absolutely. With the new iterations.
Right. Like the changes in Medicaid that are coming in the fall, I think are going to have a huge impact, because if we can't pay for care, right, like, people aren't going to get help. People are going to be more hesitant to be seeking help. So I'm worried about that. I think, though, that, it's hard to say, like, in 1 year. Like, I'm happy that it looks like we're headed in the right direction. I'm very worried, though, that I think it is easily reversed, because I'm not seeing in practice, on the ground, the implementation of policies that I believe will, help put us on the right track. I think we're in this very rumbly moment right now where we're seeing some data, but I'm also picking up the phone and hearing people who need help who can't get help. So, and I see an increase in that. So it'll be interesting to see where we're at in 6 or 7 months. We need a sustained kind of like New Deal effort, right? That we stick to, no matter who's in office.
Right.
That's just not what's happening right now.
Well, okay. If we move upstream further, which, I'm a big advocate on what I call the upstream mind, in obviously we can wait for the governments, we can wait for your employer to come in and try to help you when you're in a position where you need treatment.
Right.
But there's a massive opportunity I think we have as a society and as humanity. As Desmond Tutu said, we need to stop pulling people out of the river, and we need to go further upstream and find out why they're falling in the river in the first place. And I think there's a massive missed opportunity so far. And this is where the Brighton Initiative, and that's where we live every day, is in this preventative mental wellness realm, knowing that, 1 in 5 people currently are in considered mental health crisis mode. So going back to my first comment I made about moving upstream, where do you see the individual accountability at the end of the day? I mean, when I stopped drinking, I literally looked in the mirror. I didn't need anyone to tell me I was having a problem. I just witnessed my life around me crumbling, and I stopped drinking that moment. Now, I know that's not common. It's probably not as uncommon as people think. I think a lot of people are fairly pragmatic when it comes to this, especially if you lose a family member. But how much of this is really just, at the end of the day, comes down to just, I'm not saying toughen up, but having some accountability, the choices that you make. There are accountability with every decision, every choice that you make. And I think sometimes we want to point the finger and blame it on the government or blame it on our employer or our work environment. But at the end of the day, I know in my case, no one forced me to drink alcohol or forced me to gamble. These are decisions I made, whether or not they were, chemically in my body being induced. I'm sure that matters, but at the end of the day, I decided to stop. Are we overcomplicating this at some point, Ryan? In that we're trying to understand all the symptoms based with addiction and substance misuse, and maybe we can simplify this a little bit. I don't know the answer. I'm just trying to think. We can't just keep throwing good money at bad, and we can't just cross our finger and hope the problem will go away. And I think there's an opportunity in the prevention realm, either with AI or with, whatever we can do with technology today can really be an ally versus an enemy. What's your thoughts on that?
So I'll unpack, there's a couple questions there. I'll unpack the accountability piece first. Like, do I believe in personal accountability? Absolutely. Like, every morning I wake up and make conscious decisions to, reduce harm in my life, right? And that's, I don't use drugs, I don't drink. Like, I, try to be the best person that I can be without burning myself out. Like, I am able to make those decisions today of sound mind and body, right? But I also can draw from my own personal experience where I was hit with that kind of personal accountability, pull yourself up from bootstraps, here's a wet washcloth, and make the decision many times early in trying to seek recovery. And for me, it wasn't until I had access to medication, buprenorphine, that allowed my brain to heal and helped my brain heal, for me to be able to get into a place where now I, like, on my own 2 feet, like, decisions I make today.
But you had to get there.
I had to get there, right? Like, I needed that help. There was clearly a chemical, imbalance and hijacking that was going on that completely, altered my decision, capabilities. And that is, rooted in deep science and research and evidence. So correct. I think, we need to, it's a mix of the clinical and the non-clinical, and also, it's community based too. And that's why I'm a big believer in all sorts of tools, whether they're technology or in-person peers, right? Like, I had been, unhoused for multiple years. I had like a whole different safety net and system and way of thinking that needed to be reprogrammed and new learned behaviors that I needed. And that takes time. So, do we overcomplicate it? Sometimes we do, but do we need to be doing more to get people to a place, where they can, take that full personal accountability? Yes. But, I think that oftentimes we, ignore a lot of the cultural and systemic and environmental factors that are involved too, right? Like, not everybody who wants to stop comes from, the same place or resources or experiences as you or me. And like
childhood trauma.
Being gay for me was like a big thing that like needed to be unpacked. And, I mean, and I'm a white guy that had like some means and family that like wanted to be there and support me. Like oftentimes people don't have any type of support system. And so, like, everybody's very individualized, and like, I kind of always use, and it's not the best analogy, but it's like almost like cancer, right? It's like when somebody has cancer, it's typically not one treatment that they're like, hey, we're going to do this. And if this doesn't work, we're going to do this again, and we're going to do this again. No, usually it's, we're going to try this, and it's a specific chemo for your type of cancer. And if that doesn't work, we're going to try this next treatment and this next treatment and this next treatment and this next treatment until this next treatment until it works.
Yeah.
Right. And it's kind of similar with, I think, addiction and mental health. And like, this is where one of the, I won't go into this because this is like a personal thing to me, but it's like, it's where the conversation around, that's emerging around like psychedelics takes place. It's like, okay, at some point, like that's an option. You know what I mean? Like,
right.
So, we have so many tools these days that we need to be like, the way I like to say is kitchen sink it, like we need to kitchen sink this, and not look at. Like,
I learned from you a long time ago, Ryan, about your pathway is your pathway, and and again, I see so many people in the recovery community that are fairly siloed, where AA worked for them, so now that's the gospel. It's like, you got to go AA because nothing else works. Yeah. And didn't work for you, but there's plenty of pathways in recovery. You talk about psychedelics. I mean, obviously that's a huge, again, another opportunity. I don't know if you saw the most recent Forbes magazine, but my friend Omani Carson's on the front cover, and his big thing right now is, using these plants have been around for many years and helping people get through whatever they're getting through, or maybe not necessarily even fighting, but just ascending to another level of spirituality. Maybe these psychedelics can assist and open these neural pathways. I don't know that much about this space, but I know that there's a lot of very smart people that are, throwing their hat in the ring, becoming advocates, investors, collaborators. I think Texas just passed an Ibogaine initiative. I had some friends that were very active in that, and that's, I think, specifically for veterans with PTSD, which Ibogaine's been shown to be very beneficial. So I think the exciting part for me in the recovery community, and for me, I don't use the word sober. I just don't like that word personally, Ryan. But for me, I've not drank alcohol. Yeah. I've not drank alcohol for 8 years. So I'm a little behind you. You think you said 11. And I don't, it's hard to explain. It's like, I think when we start thinking of addiction or substance misuse or even mental health as linear, then you're really setting yourself up for disappointment, because the minute you get something figured out, you get that phone call, somebody dies, or you get the phone call from your doctor, hey, are you sitting down? It's like, once you get one thing figured out, it seems like life just tends to throw more challenges. And I think if you think of mental health as some summit to climb or some goal to attain, you think you're going to be setting yourself up. It's a daily experience, and using all the resources and tools around you to make sure that you stay out of the evils of being addicted to drugs or breaking the law and things like that. Again, combination of personal choices, combinations of the economies, your demographics, all these things add up. But I think no matter who you are, there are organizations like Mobilize. There's people like you out there that are available, 24/7, literally, to help. And it's encouraging to me. I see the good on the recovery side of the community, but I know a lot of people get frustrated too with maybe lack of progress in some areas. But
you got to be honest. The whole system, right? And I use this analogy a lot. Like, our entire addiction mental health care system is being held together these days by duct tape and like the goodwill of really exhausted people. I know. And all showing up to do the best we can, and the best versions of showing up as the best versions of ourselves in this work. But like my key tenet at Mobilize Recovery, our one of our key organizing principles is we've got to be constantly recruiting new people, new ideas, new methodologies, new tactics into the space, because we can't do it all. And we can't do it all alone.
Right.
Like, there's no such thing as a go it alone strategy in this work. It has to be together. And I can't do this forever, and you can't do this forever.
Right.
I believe that, hopefully there are others down the road, and maybe even right now, who will or are thinking or are planning or are working towards doing it better than any of us ever could have imagined, because that should be our goal. Our goal, if we're good advocates, should always be to put ourselves out of business,
Right. Yeah.
On the advocacy side, not on the business side. On the advocacy side, because I know you've got.
I understand that.
I don't want to put Brighton out of business, but it would. But hypothetically, it would if Brighton's goal, right, was to eventually one day not be needed. That's the goal. Yeah. You know what I mean? And when I say be out of business, that's what I mean. We want it to be so successful, the work we do so successful that we are no longer needed to do it.
No, I completely understand that, because I'm been on the back conversations with some of these organizations that are in charge of the beds and the inpatient care and stuff like that, and when you hear them talk about how many beds they have available and it's hurting their cash flow, and I'm sitting there sometimes saying, man, how about none of the beds are full? That every bed there is vacant. Wouldn't that be the optimal goal of a recovery community center, is to basically look around and saying, hey, nobody's here.
Yeah. And also you would think too, not just nobody's here, but I mean, for me, it's the repetitive business, right? The revolving door.
Yeah.
I think that the revolving door of treatment because I had been to treatments in the 2000s where it was every year I would be there and it would be the same group of people that were there. And I'm hey, I remember from last year, that says a lot about as much about the treatment as it does about the person, in my opinion.
Right. Yeah. Yep. I fully agree. Well, let's do this. This is perfect. I enjoy this conversation. I could talk for you or talk with you forever on this topic. And we do. I mean, full disclosure, Ryan has been you've been one of these people that if I have a moment and I need to call somebody, you are on my one hand short list. And I have called you at Sunday at midnight in tears. But again, I think that's the beauty of advocacy. And you're right, it's taxing. This being a CEO, founder of a tech company at almost 60, I'll be 60 in a few months, wasn't what I signed up for at 50. I thought I'd be golfing or scuba diving every day, but you lose half your family between 50 and 55, and life has other plans for you, right? Mm-hmm. And I think if I'm trying to emulate anything, it's this idea of constantly learning, constantly challenging yourself, and put yourself in a position where your voice can be heard, and that's through advocacy. Right. Whether you're going to be on a board at a community center or write a book, which you have multiple books. In my case, I host a podcast. Just get yourself involved at some level, and you'll attract people like you. And then together, we can all make a huge difference, whether it's substance abuse, alcohol, gambling, suicidal ideation, whatever you may fall under. We are certainly stronger together than we are by ourselves. And so maybe updates on what you have coming up. I know you and I are going to be in an event that I'm very anxious to be at. That doesn't have anything to do. Well, kind of does. I know he's very, very big in the recovery community. Maybe share with where you and I are going to be spending some time together. I'm really excited.
Yeah. Well, that'll be our next podcast.
Okay. I won't share it because
give us something to talk about post-March.
But let's just say it's going to be an opportunity for me to just meet some people that have moved mountains on one area of their line of work, and now they're throwing in their hat into the ring and to be, philanthropists towards the end of their life, doing good with what they've done good with. And there's a lot of people like that in the recovery community. And like you said, we need more people that are willing to invest in startups or fund a nonprofit or anything to do with capital, which is so needed in this space. Well, yep. I'll tie this up by just asking you one question. What's next for you after, let's say you win and your political career is going off well? Do you have any other crazy ideas? Not a Winnebago driving across country. I won't be doing that either anytime soon. But what in a perfect world, if you had lots of time and you were done with a lot of what you wanted to do, what's something that you'd want to do?
Teach.
Okay. Awesome. I love that. Like at a college?
Yeah. I'd like to teach.
Awesome.
Yeah.
Awesome.
That's kind of like my dream is one day to be able to, I don't know if I'll ever be able to retire.
Awesome.
But I'd like to find like space in life to be able to just, share everything that I've learned with.
Oh, that'd be great. I would love to take a class
I'd like
taught by you about any of these topics. That would be great. Because you're teaching in real life, and that's what makes you a special person, Ryan. So how can people reach you?
Yes. Check out Mobilize Recovery, first and foremost, mobilizerecovery.org. And you can always check me out in my books and be in touch with me at ryanhampton.com. And Jeff, I love you. Thank you for having me.
I will say this. I know you're not going to say this, so I will say this. But we need people like Ryan in office. We need people like him at a high level of policy making. And so if you have some spare money and you'd like to donate to Ryan's campaign, I will make this link available. You don't have to live in Nevada to make a campaign donation. So I will make that available. I will say full disclosure, I have donated, and I will, if I could donate more, I would, Ryan, you know me.
I know.
But we need to invest in people that are in the trenches. And I can't think of anybody running for office that I'd want to have more confidence in than you, Ryan. So good luck. I'll be out there knocking on doors, handing out brochures for you. So appreciate all you do. Love you too, brother. And thanks for being on the podcast.
Thank you.